Building on the impact of good storytelling, the Better India has evolved over the past 15 years into a repository of India's change agents. Skillfully harnessing the potency of storytelling, the platform has embarked on a mission to empower every citizen to become a formidable force for positive change. With a robust presence across 5 languages, the Better India resonates with more than 200 million people every month. Here's the story.
Anuradha and I started noticing so many incredible people making a difference, and it started to kind of make us think, how could we make every citizen, every single citizen of this country a change maker, a force of good? And that is when we decided that we needed to create this movement. Better India today is India's largest platform that uses the power of stories to drive massive positive change. We are, I would say, the single largest archive of this country's goodness. It's been incredible to see the impact we've had, right? We brought water and sanitation in villages. We've helped urban slum schools get funded. We've helped farmers come out of poverty. We've even influenced some of the policies around environmental conservation. We've been able to kind of really drive both influence and inspiration. And really what kind of drove the idea of the Better India was this whole passion movement. We didn't apply the lens of conventional economics that otherwise govern the media sector. Because look, everybody needs inspiration. There's no way I can put that behind a paywall.
Our audience base of over 200 million people are so engaged and so lovingly share stories. You see these long emails from senior citizens who are telling us how they engaged with the story that they read and how they are now, adopting some of the solutions that they have come across. Say, for instance, a rainwater harvesting. What we proactively try to achieve is to bring the solutions as well as the problem solvers together. To give you an example, a project that we undertook internally to revive ponds in the drought-stricken district of Nagapattinam in Tamil Nadu. This was an area that was arid, that was prone to droughts year after year, and the population there was really suffering. We brought together NGOs that are working in the environmental sector to identify and then pool resources, crowdfund, and be able to revive several ponds in that district, impacting over 20,000 people.
We work with corporates and brands to partner with them on causes that they believe in and the causes that we believe in. Some of the ones that really stand out is this project that we created in partnership with Tata Communications called the School of Hope and Empowerment, where the idea was that how could we use digital storytelling to create entrepreneurs in rural India out of rural women. We also partnered with Niti Aayog, where the objective was lots of school children who have some great innovations, innovative ideas. How could we bring them to the forefront, get them to a formal process, get them incubated and so on. So we actually ran the whole innovation marathon, the ATL innovation marathon with Niti Aayog, spanning across 2,500 schools across the country.
For the Better India, from its inception, the main idea has been to use technology for social good. We are developing currently what is going to be India's largest database of service providers for the social impact sector. The other project is the use of artificial intelligence to create a bot that's going to be able to pass solutions from across across industries and be able to provide those solutions for pressing problems. Another one is the launch of a modular educational platform. It's called Careers with Purpose. It's aimed at helping any working professional to gain access to careers in the development sector.
What we are very, very clear about is that we want to be that really massive force to transform the impact sector, to really help them accelerate everything that they've been wanting to do, access to customers, get resources, talk about their impact, all of that. How can we help accelerate what would otherwise happen in 30 years? How could we help them have that in a year?
In the realm of healthcare, it's not merely limited access that leads to high mortality rates, but also poor care quality that kills the most vulnerable. The situation is especially grim for critical patients in small-town India, where shorter timely treatment is slim. Driven by a mission to save lives and revolutionize healthcare, Dr. Shuchin Bajaj founded Ujala Cygnus. These hospitals offer high-grade intensive care to the marginalized and vulnerable across 5 states in India. The misconception that critical medical intervention must come at a steep price has been challenged by Dr. Bajaj. This is the awe-inspiring story of Ujala Cygnus.
I would get a lot of calls. Somebody's had a heart attack, somebody's had a head injury, somebody's critical, and we are bringing them to Delhi. I would keep waiting for them all night and they wouldn't turn up, and I would get to speak to them in the morning, and I would hear words like, oh, the patient passed away on the way, he died on the way, and we turned back and now we are back in our villages. I would hear stories like, oh, maybe it's good that this person died on the way. The last one that did make it to Delhi stayed in hospital for 15 days. His wife had to sell their house, their fields. It's not just poor physical outcomes that you get if you stay in far-off communities, it is also the poor financial outcomes. More than 6 crore people slip below the poverty line every year in India just due to healthcare shocks. I dropped out of my super speciality course to start these hospitals in the small town. Started out with a very small single hospital, and now we have 20 hospitals across 5 states of North India, catering to all kinds of emergencies, serious illnesses, heart attacks, head injuries, intensive care, and all this at very high quality hospitals, and all this at costs that are less than 20% of what the big city hospitals have. Many people question us on how we make all this sustainable as a private enterprise, because we don't get aid or help from anyone, and we have private equity investors on board to answer to. So we started renting out buildings instead of buying a piece of land and building the hospital. That was the traditional way to go for most doctors. Second, we've successfully flipped the private healthcare model from a very low volume, high cost model that it traditionally has been to a very high volume, low cost model. And third, of course, financially it works very well for us, because the moment we cross a certain Rubicon of revenue and patients, most of the money then starts flowing into the bottom line. So we have been also the champions of the Ayushman Bharat scheme. We were the first corporate hospital to adopt that scheme wholeheartedly, when most corporate hospitals were very wary of it due to the lower prices. The first mitral valve surgery was done under the Ayushman Bharat scheme at one of our hospitals. Now we also do minimal invasive double valve replacements through open heart surgeries. We do bypasses through Ayushman. We do cancer treatments through Ayushman Bharat. Even though our main business is running hospitals, but we do try and make sure that people don't come to hospitals. So that is how our Sehat Chopal and our telemedicine programs were born. We go village to village screening patients during the Sehat Chopal. So we do almost 1 to 2 Chopals around each of our 20 hospitals every day. Each Chopal we will screen patients for tuberculosis, for eye diseases, for diabetes, hypertension, to make sure that their quality of life increases, and try and make sure that they never have to come to a hospital for complications of these diseases. having treated more than 2.5 million patients till today, having done more than 150,000 surgeries till today, and those are the numbers that we are really proud of. We are looking to expand into 4 more states in the next 3 to 4 years. India has more than 783 districts, and unfortunately in more than 550 of those districts there is no tertiary healthcare available. People living in all those districts have to go out to their surrounding cities or faraway cities to access healthcare. And as I said, this leads to poor physical and financial outcomes, which we are doing our best to prevent.
Creating social impact isn't just the work of one individual. It's a collaborative effort driven by a group of dedicated and passionate individuals. There isn't just a single issue that demands attention. There are numerous challenges that call for the same level of dedication that's been shown by these 4 change agents. We salute the social enterprise displayed by Dr. Aparna Hegde, Bijal Brahmbhatt, Anuradha Parekh, Dhimant and Dr. Shuchin Bajaj. It is now time for us to announce the winner of the Social Entrepreneur of the Year for 2023. Dr. Shuchin Bajaj, founder director of Ujala Cygnus. Congratulations to Shuchin and the entire team. We at CNBC-TV18 hope you continue with the stellar work that you are doing. Congratulations to all our change agents. We at CNBC-TV18 will continue to bring more stories of change, transformation and impact to inspire change makers within each one of us. I leave you with this quote from Theodore Roosevelt, who said, and I quote, "Do what you can with what you have, where you are." From all of us here on the team, goodbye. Thanks for watching.